Thousands of people are in limbo and possibly without insurance as United Healthcare and the UNC Health System are still at odds over contract negotiations. Good evening. This is the Fox 8 5 o'clock news. I'm Neil McNeil.
I'm Katie Nordine. Last month, we introduced you to Janet Mazurko, a High Point cancer patient, and she had to choose insurance or the doctors that saved her life. Fox 8's Sarah Winkleman caught up with Janet. She is in the newsroom this evening. So, Sarah, it's decision day for her. What did she choose?
Well, she chose to do what she calls her family. She chose to stay with them, her team at UNC Health, which means she had to get new insurance, and it's sure going to cost her.
My number one concern is, where do I find thousands of dollars?
A new insurance contract signed and the reality set in.
I will have to go back to work. I have a major surgery scheduled for next week. And once I recover from that surgery, I will have to find a part-time job.
The stage 4 cancer patient is on disability because of her chronic condition, but she plans to work as much as she is allowed on her disability to pay for the increase in copays, deductibles, and a new maximum out-of-pocket price to reach.
I never thought that insurance would stand in my way of life or death. I thought of a lot of other things, but it was definitely not insurance.
Janet has spent countless hours on the phone to find a solution. She reached out to the North Carolina Department of Insurance, who in a statement said NCDOI does not have jurisdiction to intervene regarding contractual disputes or require that a company or provider enter into a legal contract. She took it one step further to the state legislature to push for more transparency when it comes to insurance contracts.
Patients need a seat at the table. Patients need to understand how the process works. I learned a lot, and I learned that what United Healthcare is doing is legal. It's not ethical, but it's legal. And that's two different things, and I think it's important for citizens to understand that.
In a statement to Fox 8, United Healthcare said, "We are committed to utilizing the time remaining on our contract to reach an agreement that's affordable for North Carolinians and employers." And a statement from UNC Health System reads, "Unfortunately, we have not yet reached an agreement. We take very seriously the potential disruption this may cause our patients, and we're doing everything in our power to avoid that outcome." The deadline to agree is April 1st, but in order to make sure Janet can apply to new insurance, get processed, and have coverage by April 1st, her time is up and her decision made.
That's vital to me. That's a life or death situation. My calendar stays booked with health care appointments.
And it's not just Janet. Thousands of other United Healthcare customers are at risk of being out of network at UNC Health starting March 31st if the two remain at a standstill. Katie?